Welcome to the October 15th, 2010 MSF Frontline Reports Podcast. Doctors Without Borders, Médecins Sans Frontières, or MSF, is an independent medical humanitarian aid organization. I'm Michael Goldfarb. The Kashmir Valley has been in the midst of increasing civil unrest since June. Deadly clashes between protesters and security forces have led to strict 24-hour curfews. MSF has been providing psychological care in Kashmir since 2002. But the latest violence and a substantial military presence on the streets are keeping people from accessing much-needed mental health care. Since June, the MSF team in Kashmir has been adjusting its strategy in order to reach those who need help the most. Melissa Pracht brings us this report.
Even before India and Pakistan won their independence from Britain in 1947, the territory of Kashmir was hotly contested. The local Maharaja wanted to stay independent, but eventually decided to accede to India rather than Pakistan. Key powers were signed over to the Indian government in return for military aid, as well as a promised referendum, which never came to fruition. Since then, Kashmir has been the flashpoint for two of the three wars between India and Pakistan. Recent decades have been marked by violence and instability, which have left tens of thousands of people dead and thousands more disappeared. MSF began mental health activities in Jammu and Kashmir nearly a decade ago in an attempt to address some of the trauma that the population has endured.
So we're talking about the youth that has grown up between 1989 and 1999. So this is the generation that is in the streets, and this is a generation that has grown up with violence and has only seen but nothing but violence. And so you can imagine the mental health and the psychological impact on their lives.
Sasha Matthews spoke to me from Delhi on Tuesday, the day that he left Kashmir after his 18-month assignment as project coordinator ended. He had been based in Srinagar, the state capital, where he ran MSF's medical activities. MSF also supports basic health care clinics, in addition to the mental health care programs in Srinagar and Kupwara. Sasha said that when he left Kashmir, a curfew was in place again, due to yet another violent incident. He described the area as, in a word, militarized.
Everything is occupied by the security forces. Every single public space is taken over, like cinemas, schools, public buildings, stadiums, and so on. There's huge amount of barbed wires. If you pull out all the barbed wire of Kashmir, it probably can go, I don't know how many times back and forth from the earth to the moon. I mean, it's just amazing. There is a huge number of convoys that continue to go up and down across the valley, and there are bunkers everywhere.
Every Friday after prayers, he said, the protests would begin.
They would sort of claim to protest peacefully, but then as soon as the security forces would come out, then stone pelting would start. Because it's basically the youth throwing stones at the security forces striking back, usually sort of in the early parts of 2009. It was more with tear gas shelling, with baton, but what happened in the summer, they were actually started responding more and more with live bullets, with guns.
People started getting killed, and a killing would spark another protest and more stone throwing, which would result in more deaths. That continued through the summer, he said. 11 people were killed in July and 20 in September.
The government sort of decided to respond to this increase in violence by imposing very strict curfew. So already curfew was a very common thing for Kashmir, but over the last period we have seen even more strict curfew. And this means literally that in some areas, sort of the areas that are more prone to violence, mainly the downtown parts of Srinagar and other localities, have security forces literally in front of every house door. So people cannot come out.
There are curfew passes for non-governmental organizations and some businesses, he says, But those are no guarantee that MSF vehicles are allowed to pass through the checkpoints or that staff are safe from protesting crowds. This means that MSF often cannot reach its counseling centers, but more importantly, people can't reach the counselors. So after 8 years of providing mental health care in Kashmir, the team has had to change their approach from a far-reaching community-based project to what Sasha calls mental health first aid.
So our core activity is counseling. When we first arrived, the mental health hospital Srinagar was an asylum. People were basically chained to the beds. Hygiene conditions were extremely poor. There was no hot water for the patients, and the families would abandon the family members in this asylum. So we rehabilitated part of the hospital. And then soon after that, we opened our first counseling centers. And then after that, we expanded quite rapidly in other districts. So now we currently work in 18 counseling centers.
The team also conducted awareness-raising activities in the communities that have been affected by the violence.
We're talking about former detainees who had undergone torture. We talk about women who are widows. We talk about young women who... There's a particular village in Kupwara where we work that there's a high suicide rate among women. So we try to do in-focus group discussions with these groups to try really to understand what their issues are so that we can then help provide them the support.
This summer, those activities became largely impossible, Sasha said.
So we re-questioned ourselves and said, okay, how can we respond? And we said, well, okay, there is a huge number of injured turning up to the hospitals. So since February, we started a mental health first aid approach. And, June, July, in August, and in September, the violence was so much that it has become the core component.
The team saw a lot of new patients at the hospitals, but moving around Kashmir is still problematic.
As I said, we do have these curfew passes. Sometimes they're not respected, but we are seeing that more and more that we try to go out even in the most difficult days. People are realizing who we are and that it is important. So the security forces, the more we try to be out there and showing to the people what we do, then obviously this increases our security.
The team also developed new ways of seeing their established patients.
So we came up with phone counseling and also occasionally home visits. The phone counseling and home visits is only possible for follow-up sessions and not for new clients. This is because obviously you need to know the person, you need to understand what kind of symptoms this person has, and some of our clients can be treated by phone counseling, others cannot. But this is a plan B scenario, basically to respond to adapt to current context. At the end of the day, the people of Kashmir need adequate mental health facilities so that they can go on with their own lives. This is something which is very important.
Another way MSF has been promoting its mental health care activities in Kashmir is through a long-running radio soap opera called Alao Baya Alao, or Call Brother Call. We're hearing an excerpt right now. Listen to next week's podcast to hear more about how MSF is using this radio soap opera as part of its mental health care activities in Kashmir.
For more information on this story and to learn more about MSF, please visit msf.org to find the MSF website in your home country. MSF is an independent medical humanitarian aid organization that delivers emergency assistance to people affected by wars, epidemics, and natural or man-made disasters in more than 60 countries.